Hello, everyone. I'm Cheryl Fite, and thanks for joining me in part 15 of the Hospice CAHPS Survey Question Series. This week, we will continue the discussion on training family to care for patient, which focuses on question number 23. Did the hospice team give you the training you needed about how to help your family member if he or she had trouble breathing? And we want this answer to be yes, definitely. Not only because this is the only answer that counts towards hospice honors, it's because we always want to be seen as doing the best for our patients. This question contains an added answer for the family to choose from, which is, I did not need to help my family member with trouble breathing. Remember that the only answer that counts towards hospice honors is the yes, definitely answer. But at least there is an option for those that didn't have issues to choose from. Let's do a quick review of part 8, which was question number 22. How often did your family member get the help he or she needed for trouble breathing? And we discussed different ways to help, such as completing a thorough care plan assessment and having meds on hand. And when those calls come in, make those PRN visits and keep that caregiver informed of what you are doing. Follow up with a phone call if your next visit is scheduled days away to ensure that the medications and or the measures that were implemented during that visit is working so that you'll know if those measures need to be changed. We talked about teaching the caregivers what to do while they were waiting on you to arrive, such as providing their loved one with calm support, keeping the room cool, turning a fan on and placing it so that the breeze blows across the patient's face. We talked about teaching patient and caregiver breathing techniques, such as that diaphragmatic or belly breathing, as well as pursed lip breathing. And let's not forget medications. There is also some great teaching information in the training manual. And as stated, always update the caregiver receiving the survey to make sure that they are well informed. While visiting your patients that have respiratory issues, don't be afraid to ask questions. Consider asking, how is your breathing? Is it better or worse? Have you had any trouble breathing since our last visit? Did you have to implement any of those measures that I taught to help relieve your trouble breathing? And if so, did it work well for you? Do you feel that you or your family member need additional training? And lastly, do you have any questions? Make sure that you are educating and that they do understand your education that you've provided. Hopefully this has provided some useful information to assist you in helping your patients with trouble breathing, or maybe it has sparked some other ideas. Well, team, that concludes part 15 of the Hospice CAHPS training session. Take care, and as always, thank you again for all that you do.